In this topic, we will be discussing what are the nutritional requirements at the time of disease and during certain special conditions. So, as far as a disease is concerned, one is acute illness. So, acute illness, high fever and other thing. Then nutritional need increase during acute illness to support recovery and manage symptoms and prevent complication. So, that is one important feature of the acute illness, especially protein, energy, vitamin and minerals and hydration. And with regard to protein, especially if you are having a very high fever, most of the time you may not be taking, and after that, unless you are taking sufficient food, your body may not be able to come back to your normal weight level. So in the case of protein, it should be around 1.2 to 2 gram per body weight during and after a illness. Then energy needs may increase by 20 to 50% in severe infection and trauma. And during that time, high calorie foods like nuts, then avocado, full fat dairy, full cream dairy, milk are very helpful in improving your condition. And similarly, necessity of vitamin C, zinc and vitamin A are also high during the time of illness. The water level, fever and infection often increase fluid loss. So sometime during the time of fever, there will be diarrhea, there will be vomiting, and lot of fluid will be lost from your body. To ensure that adequate water is there, adequate intake of electrolytes are there, you have to drink more water. Then different type of diseases are there, and chronic disease. Chronic disease means, for example, diabetes. Once you have diabetes, it is with you throughout your life. So chronic disease are those diseases which are with you for a long time. So chronic illness often require dietary modification to manage symptoms and slow the progression of this disease. For example, coming to the carbohydrate, diabetes mellitus, there are three situations. One is carbohydrate. Focus on complex carbohydrate with a low glycemic index to maintain sugar. That is, glycemic index means low sugar level. So those carbohydrates, for example, when you are eating, the diabetic people will be usually eating the robust banana. They may not be eating other type of banana because robust banana generally contain less sugar. Similarly, they will be eating more chapati because that also contains less sugar. So this kind of food which are low in glycemic index are preferred for are better for people with the diabetes. And similarly, fiber. High fiber foods will help you regulate blood sugar level. So taking plenty of food with high fiber can certainly reduce your blood sugar level. Then fats, replace saturated fats with unsaturated fat. Especially, for example, the generally plant fats are containing high level of unsaturated fat. So eating a lot of vegetables may be helpful for a person with a diabetes. Then protein, maintain moderate intake of protein to avoid excessive kidney burden. That's also a problem facing people with the diabetes. Their kidney can have overload. So to prevent all those situations, we have to maintain a moderate level of protein. So that is regarding the diabetes mellitus. And coming to the second one, that is cardiovascular disease. And in the case of cardiovascular means heart and circulatory problem, limit the intake of saturated and trans fat, as emphasizes omega-3 fatty acid from fish and nuts. So that is, a person with a cardiovascular or heart related problem should not be taking too much amount of chicken or beef. Instead of that, they can have plenty of fish. Fish doesn't have much of the saturated fat. At the same time, fish is good for the health of the heart. Then the intake of sodium, reduce the intake of sodium, because more amount of salt in your food means more amount of water retaining, and that means the pressure of the blood will be increasing. So that is why people who are having cardiovascular disease, BP, etc., they should reduce the intake of sodium chloride or sodium. Then potassium, include potassium rich food like banana, spinach to counteract sodium effect. So if you are not reducing if you are reducing the intake of sodium, eating a lot of banana may be helpful. Then another is the fiber. soluble fiber which are obtained from legumes and oats, that will be helping to help you to reduce the level of LDL cholesterol, low density lipoprotein, that is the full form of LDL. So this kind of diet modification may be helpful for a person with a cardiovascular disease. Then what you can do in the use of a kidney disease? What are the type of nutrients which are advised during the time of a kidney disease? As far as protein, adjust protein intake based on the stage of kidney disease. High protein in early stages and restricted in advanced stages. When a kidney is having some problem, kidney may not be able to process too much amount of protein. Then similarly, sodium and potassium, minimize sodium and monitor potassium intake to prevent imbalance. And similarly, phosphorus, limit food with high phosphorus, dairy, cola, drinks, etc. to prevent bone issues. So these are some of the special modification in food which you can do during the time of kidney disease. Then cancer. Cancer means increased need for hypermetabolism and tissue breakdown. That is one situation. Antioxidant like vitamin C, E and selenium, they will be very helpful in reducing the stress caused by oxidative stress. Then small frequent meals, instead of having large intake of food during a meal, try to reduce the intake of food and spread the intake of food to instead of 3 you can have 4 times a day. Small frequent meals to combat loss of appetite and nausea from treatment. Generally people with cancer may not be able to eat a lot of food. So what they can do is that instead of taking 3 meals, they can have 4 or 5. Avoid irritating food like spicy, acidic or rough food. They can exacerbate symptoms like mouth sore or nausea. So this kind of modification may be advisable for a person with cancer. Then obesity. As far as obesity is concerned, calorie control. Create a calorie deficit through balanced diet and portion control. That is try to reduce how much. For example, you are taking rice. Try to reduce the intake of rice every day by a little. Then fiber intake. High fiber diets increase satiety, that is feeling of satisfaction, and reduce calorie intake. That is, if you are having a lot of vegetables in your food, that will be most of the time giving you the fiber. That will make your stomach full. That will give you a feeling of fullness of your stomach, so that you may not feel to eat more. Otherwise, if your stomach is empty, you may eat a lot. Then protein, that will be helping to preserve your lean body mass during the weight loss. Then healthy fat, especially fats which are obtained from plant-based oils like olive oil, while limiting saturated. That is, for a person with obesity, taking too much chicken, beef, milk, etc., chocolates, etc., are not advisable, because these are containing a lot of saturated fat, and that will be increasing your body weight. Then another situation is malnutrition. In the case of malnutrition, energy dense food. What is malnutrition? Incorrect nutrition. That is actually the malnutrition. Generally, we say the deficiency, nutrient deficiency, are considered as malnutrition. So what we can do for a person who are not getting enough amount of nutrient, they should increase the level of calorie, they should increase the level of nutrients in their food to meet their energy requirement. Similarly, they should also take a lot of vitamin A, vitamin D and vitamin B12, along with a lot of iron and zinc. So all these are micronutrients. They will be increasing your immunity. They will make your bones more stronger. Then another thing they can do is that small energy dense meals are easier to consume for individual with a low appetite. Some people may not be eating well. So what they can do is that, as I told you, instead of 3 meals, they can have 4 meals or 5 meals. So because they eat very little during every time. So that is the situation of food in the use of nutrients during the time of malnutrition. Then another problem is gastrointestinal disorders. So in the case of gastrointestinal disorder, especially diarrhea, you will be losing a lot of fluids from your body. Along with the fluid, you will be losing sodium, potassium, etc. So what you can do is that you can include a low fiber diet and also easily digestible food. So this kind of food will be able to digest and absorb by a person with a diarrhea. Then constipation, increase fiber intake. Constipation is a major problem, especially if you start working with the computer all the time, and if you are, for example, unless you are walking, there is a strong relationship with the movements of your stomach and you are walking. If you are walking a lot, your stomach movements are more, and if you are not walking, your stomach movements will be less and you will have higher chance of constipation. That is why a person who is sitting with the computer all the time, if you are in a office work all the time, you are not walking. So what you can do is that spend a lot of time every day, at least 30 to 45 minutes every day in walking, so that you get sufficient movements for your stomach. So if your body is active, your stomach is also active. That means you have less chance of constipation. Then irritable bowel syndrome, low food map diets can reduce it. Low FOD map diet can reduce, so I don't know what is this FOD map, we will check. See, the special kinds of food are known as a FOD map. Let me check what is the full form of FOD. Fermentable, oligosaccharide, disaccharide, monosaccharide. These are the type of food. A food rich in oligosaccharide, disaccharide and monosaccharide. That kind of food are known as FOD map. So this is a irritable bowel syndrome is a very common problem for many people. Nobody will be telling you, but it is still a very common problem. Because if they are eating something, they have diarrhea, they have stomach irritation, and even for example, they have a biryani from a outside hotel. Next day they will be having stomach diarrhea. So this kind of problems are known as irritable bowel syndrome. So it is a very depressing situation, and people who are facing that situation, they may be very reluctant to travel anywhere. Then another problem is coming during the time of pregnancy induced condition, especially gestational diabetes. During the time of pregnancy, some women may have a chance of developing diabetes. So focus on balanced meal with controlled carbohydrate, reduced intake of carbohydrate. Pre-eclampsia, it is a pressure, that is reduced sodium intake and increase potassium rich food. Pre-eclampsia is a disease which is affecting the pressure related problem. So those women we can do reduce the sodium intake, because more sodium means high blood pressure, and increase potassium rich food. Another is post surgery recovery, because especially if you have any kind of surgery like uterus removal and other thing, after the surgery you should increase the intake to support healing. Protein should be there, essential for tissue repair and wound healing. Up to 2 grams of proteins are needed. Micronutrients like zinc, vitamin C and vitamin A, they are vital for skin integrity and also for maintaining the immunity in proper level. And finally, stress and mental health condition. Omega-3 fatty acid found in fatty fish, these support brain health and reduce depression. So if you are eating plenty of fish, you can have good brain, good mind, and that will prevent you from depression. Magnesium can help in managing stress, and magnesium is mostly found in leafy vegetable like spinach, etc. Vitamin B, they will be supporting the metabolism and neurological health. So there is close relationship between what you are eating and how you are thinking and how you are feeling. The tryptophan, it's an amino acid. It is found in turkey, milk, banana. It aids in serotonin production. A decrease in the amount of serotonin can make you depressed. So this kind of problems are there. Even your food that you are taking can make you happy or depressed. So try to maintain a type of food which are always good. That is why eat plenty of vegetable, a lot of fruits, a glass of milk, all this can keep you healthy.